Management of congestive cardiac failure or chronic heart failure. Management of congestive cardiac failure or chronic heart failure. Management includes features, investigation and treatment. Features, investigation and treatment. Features includes symptoms and signs of a disease. First of all, symptoms of congestive cardiac failure or chronic heart failure. Symptoms are: number 1, dyspnea or orthopnea. Dyspnea or orthopnea. Number 2, fatigue. Number 3, effort intolerance. Number 4, history of causative factor such as MI/hypertension. History of a causative factor such as MI and hypertension. Signs includes signs of congestive cardiac failures include signs in on general examination and on precordial examination. On precordial examination or examination of the cardiovascular system. On general examination, we will find cold periphery. Number 1 signs, cold periphery. Then low BP or decreased blood pressure. Then oliguria, decrease of urine output less than around 500 ml. Marked weight loss or cardiac cachexia, CC, cardiac cachexia. On examination of the CVS or precordial examination, we will get the different features in left heart failure and right heart failure. Left heart failure and right heart failure. On left heart failure, there will be presence of bilateral basal crepitation. Number 2, apex beat shifted. On right heart failure, there is presence of left parasternal heave. Number 2, raised jugular venous pressure. Number 3, tender hepatomegaly means enlargement of liver. Tender hepatomegaly. Number 4, epigastric pulsation. Number 5, dependent pitting edema. And finally number 6, ascites. There will develop ascites. Right heart failure. Signs of right heart failure includes left parasternal heave, increased jugular venous pressure, tender hepatomegaly, epigastric pulsation, dependent pitting edema. Now, investigations done in case of congestive cardiac failure or chronic heart failure. They are chest X-ray. Number 2, ECG and echocardiography. ECG. Number 3, echo. Number 4, cardiac enzymes. Number 5, blood test. Blood tests includes CBC, electrolytes, renal function test, renal function test includes serum urea and creatinine. Serum urea and creatinine. Renal function test includes serum urea and creatinine. Then thyroid function test. Finally, BNP, brain natriuretic peptide. BNP, brain natriuretic peptide. Last part, treatment of chronic heart failure or congestive cardiac failure. Treatment. Treatment includes education counseling about current health state. Number 1, counseling. Education counseling of the current health state. Drug treatment, or that means pharmacological treatment, non-pharmacological treatment, and finally some general advices. Pharmacological treatments. Pharmacological treatment includes first of all diuretics such as furosemide, then aldosterone receptor aldosterone receptor blocker such as spironolactone, angiotensin converting enzyme inhibitor or angiotensin receptor blocker, ARB block. Then nitrates, beta blockers is contraindicated in acute left ventricular failure. Others drug includes ivabradine, which decreases heart failure. Ivabradine which decreases heart failure. Neprilysin inhibitor, sacubitril. Neprilysin inhibitor, such as sacubitril. Then digoxin if arrhythmia present. Amiodarone. Digoxin is given if arrhythmia present. Amiodarone if arrhythmia present. Both are given if arrhythmia present, digoxin and amiodarone. Non-pharmacological treatment includes non-pharmacological treatment includes implantable cardiac defibrillator, ICD, implantable cardiac defibrillator. Coronary revascularization, that means angioplasty. Number 3, cardiac transplantation. Cardiac transplantation. Number 4, pacemaker transplantation. Pacemaker. General advices. Include, first of all, diet includes nutritionally balanced, then weight reduction for the obese, salt reduction, then avoid alcohol, smoking cessation, stop দিতে হবে. Number four, exercise regularly. Exercise regularly. Finally, number five, vaccination against influenza and pneumococcus. Vaccination against influenza and pneumococcus. Influenza and pneumococcus. Vaccination against influenza and pneumococcus. Management of chronic cardiac failure or congestive chronic heart failure or congestive cardiac failure include features, clinical features, investigation and treatment. Clinical features consist of the signs and symptoms. Symptoms include dyspnea, dyspnea or orthopnea, fatigue, effort intolerance, then history of myocardial history of positive factor such as myocardial infarction and hypertension. Signs includes on general examination and on precordial examination or examination of CVS. General examination findings are cold periphery, decreased blood pressure, oliguria and cardiac cachexia. That means marked weight loss. On CVS examination, they vary in left heart failure and right heart failure. Left heart failure findings are bilateral basal crepitation. Number two, apex beat shifted. It is shifted. Right heart failure includes left parasternal hip, increased jugular venous pressure, tender hepatomegaly, epigastric pulsation, edema and ascites. Investigations are X-ray, ECG, echo, cardiac enzymes. Blood tests include CBC, electrolytes, renal function tests such as serum urea and serum creatinine, thyroid function test. Finally, brain natriuretic peptide, that means BNP. Treatment of chronic heart failure or congestive cardiac failure includes 4 stages: counseling, pharmacological treatment, non-pharmacological treatment, and finally general advice. Counsel the patient about current health status. Then drug treatment or pharmacological treatment includes diuretics such as furosemide, aldosterone receptor blockers such as spironolactone, angiotensin converting enzyme or angiotensin receptor blocker, then nitrate, beta blockers, but it is contraindicated in case of acute left ventricular failure. Other drugs include ivabradine, which decreases heart failure. Neprilysin inhibitor such as sacubitril, digoxin and amiodarone are given if arrhythmia present. Non-pharmacological treatment protocols include implantable cardiac defibrillator (ICD), coronary revascularization, angioplasty, cardiac transplantation, pacemaker. General advices are diet should be nutritional balanced, weight reduction in case of obese person, and salt reduction, avoidance of alcohol and cessation of smoking, exercise regularly, and vaccination should be against influenza and influenza and pneumococcus.